I think the most important thing to my father was taking care of us as his family. He loved my mom so much, and I think that's what makes this story more difficult for me to tell, because even though he had dementia, the one thing throughout the whole journey was his love for my mother and how much he clung to her. Dementia doesn't just affect the person with the disease, it affects everybody around them. Being a nurse, I was very fortunate to have the understanding of how this disease works. So when he was first diagnosed, I knew that this was going to be very difficult on my family. I watched him become a shell of the person he once was. He was quiet and reserved, or the very opposite. I don't think that people understand how bad the behaviors can be. Agitation could mean throwing things, hitting other objects. For my dad, he would yell and scream, but also he would punch people or grab things away or grab people's arms. And, most of the time the people were smaller than him, and so he would knock people down. He did have an incident at my house that really concerned me. It was a birthday party, I think, we had for someone in our family. And I went in the house, and he has my son, my youngest son, cornered. And he's calling him names, and he's yelling at him, and he grabs him. And I'm like, whoa, you do not grab my son. And he did back down, but it was horrible. It was horrible for me because it was my son that he decided to target. And it was difficult to watch because I always knew that if he knew how he was acting, he would be mortified.
The stress, the fear, the anxiety that probably coming from them, because I can only imagine how frustrated and scared and anxious that I would be if someone's just walking into my room, and even if they're having a nice, calm, caring voice, if I don't understand why someone's coming in and trying to dress me, or taking my shirt off and changing it, or washing my face. I might try and bat at them, or I might try and push them away. And I think that that's something that they don't understand, and so then that creates this anxiety in the patient. And so we want to do something to help alleviate that. Antipsychotics really help patients when we are trying to suppress these negative behaviors, these agitation behaviors. So thankfully, the newer antipsychotics don't have nearly the same level of risks as the old antipsychotics. It allows them to be compliant with their behavioral care so that they're getting dressed and bathed and showered and dressed appropriately every day, and their hair's groomed and their teeth are brushed. CMS are certainly responsible for overseeing what goes on in nursing homes. They want to make sure that things are going well and appropriately in that regard. And so they serve an extremely valuable purpose. Unfortunately, I think in this particular regard, CMS puts a lot of requirements on nursing facilities in order to maintain star ratings. And if a facility has a percentage of patients on antipsychotics that exceeds the national norms, then they can often be downgraded just based upon that statistic alone. The system is failing patients without question because it's impeding my ability to provide the FDA-approved clinical indications for these medications to all of the patients that should benefit from these medications.
We need to be able to customize someone's treatment plan and not be scrutinized and have a facility cited or have a quality measure looking poorly just because we are caring for predominantly people with dementia. We need to give these people the treatment that works for them. Especially, you should not be held back just because you have to reside in a nursing home, and that's why I did this. Watching my dad go through these drug gradual dose reductions, which are a requirement, was just ridiculous. There's no cure for Alzheimer's right now. His behaviors weren't going to go away. And let's not act surprised when we take him off these meds and he punches someone. I didn't need a crystal ball. I knew it was going to happen. It happened before.
Policy should not drive care. Physicians, nurses, the medical community should drive care.
Sometimes there's joy in caring for people with dementia. I have danced with a woman with dementia, and it was about the only time she ever really made sense is when we were dancing. She taught me to waltz.
Dementia, unfortunately, is the most common neurodegenerative disorder, and there is not a single person in the world that can say that they've not been touched by dementia in some form. And so with the rapidly aging baby boomer population, we're only going to have more and more patients that are suffering from dementia.
And I'm advocating for my own self in case I get it, and I want my kids to be able to make the right decisions about what medications to give me. We need the policy to change because it should be about the people. I'm hoping that my message will improve the quality of care and give people with dementia dignity.